Welcome to Yada Yada Family Medicine. I'm Dr. James. Today we're going to talk about COVID-19. COVID-19 has been around a while now and has affected everyone in one way or another. I work in a family practice clinic and I've been exposed to this virus daily from the beginning. It was only a matter of time before I became infected from this. And I was actually diagnosed with this pretty recently. I'm now almost fully recovered. For my particular job, I have been required to get tested weekly regardless of symptoms. I started to get a headache, fatigue, nasal congestion, and a really scratchy throat. So when the body aches and chills came along as well, and the sore eyeballs, it came as no surprise to me that my weekly test was positive finally. Symptoms of coronavirus are widely varied, person to person. As we know, some infected people don't have any symptoms at all. Mild symptoms can include the following: headache, fatigue, stuffy or runny nose, sore throat, dry cough, low-grade fevers, body aches, and chills. Severe symptoms can include high fevers, pneumonia, acute respiratory distress syndrome, encephalopathy, and multi-system organ failure, just to name a few things. COVID-19 means coronavirus disease 2019. If you've heard the term coronavirus prior to 2019, there is a reason. The coronavirus has been a cause for the common cold, but this strain is new, hence the new COVID-19 designation. COVID-19 attacks the respiratory system, but it can affect many other body systems in severe, advanced cases. COVID-19 is a deadly virus and should be taken very seriously. I have been under quarantine for the last 2 weeks for a very good reason. If you are exposed to the coronavirus, the incubation phase of the virus, or period where you are infectious and contagious, but not necessarily having any symptoms, it can be anywhere from 2 to 14 days. If you do start having symptoms, you are generally considered contagious for the next 10 days of the active viral shedding. A good rule of thumb, however, is if you still have symptoms, you shouldn't be around anybody. Treatment depends on symptom severity. For the vast majority of patients, simple over-the-counter treatments and cold-type remedies can suffice. For my own case, I did take pseudoephedrine and acetaminophen and ibuprofen for my symptoms. Besides drinking lots of fluids and getting plenty of rest, there wasn't really anything else required in my case. Some people will experience severe symptoms, including pneumonia. I have had several patients that needed antibiotics for pneumonias during their COVID-19 illness. I've also had several patients who needed hospitalization because of their symptoms. Remdesivir is a newer, very expensive drug that can be given to patients in the hospital to help stop the viral RNA of the coronavirus from replicating. Again, that's only in certain cases and dictated by the hospital staff. Some people also do benefit from glucocorticoids or steroids. Let's talk about what to do if you think you've been exposed or if you are ill. First, call your doctor. If you are experiencing a life-threatening emergency, call 911. Your local health department should be a very good resource, as well as the CDC. Again, if you have COVID symptoms and need medical attention, please seek medical care. Thanks for listening. I'm Dr. James for Yada Yada Family Medicine. Stay informed and stay safe.